While Nigeria is battling with the coronavirus pandemic, the deadly Ebola virus has suddenly emerged in some African countries, raising fears that the situation may be overwhelming if Nigeria has to deal with COVID-19 and Ebola at the same time. Nigeria's Center for Disease Control (NCDC) says the country remains at moderate risk of getting the Ebola virus given the proximity of Guinea to Nigeria and other African countries. NCDC says several measures have been put in place to prevent and mitigate the impact of a potential Ebola virus outbreak in the nation amidst the COVID-19 pandemic. This next report has more details.
Ebola has resurfaced in Guinea 5 years after the country was declared Ebola-free. By the time the outbreak in West Africa, which began in Guinea, was brought under control, 11,000 deaths had been recorded with 28,000 cases that has ravaged Africa in recent times. The Democratic Republic of Congo has recently confirmed the resurgence of the virus. The World Health Organization has warned that an outbreak of the virus in these West African countries poses a regional risk that requires exceptional vigilance, especially when the region is still under the pressure of COVID-19.
An outbreak of Ebola was detected in the Democratic Republic of the Congo. 4 cases have now been reported and 2 people have died. Authorities in Guinea declared a separate outbreak of Ebola in the town of Gueke in the southeast of the country. WHO is working closely with health authorities in both countries to engage with the affected communities to enhance trust and acceptance.
The sudden resurgence of Ebola has put Nigeria and other countries on alert, according to the Minister of Health, Osagie Ehanire, and the Director General of the Nigerian Center for Disease Control, Chikwe Ihekwazu. Physicians have also warned of impending doom of the impact of Ebola on the nation and advised government to create awareness through different channels to alert its citizens.
What is most important is to have the surveillance that actually we could pick this up very, very early before it breaks out into a community infection. And that surveillance is what is most required. And for that, what you really need to do is mass education and focus on the medical personnel. I expect that by this time, the Ministry of Health should be conducting seminars for both private and public medical personnel. And now I expect that you should have specially designated isolation centers. It's not the same isolation centers you use for COVID.
To help fight the outbreak, the World Health Organization has released $1.25 million to support the response in Guinea and to reinforce readiness in other countries. An additional $15 million has been released by the United Nations Central Emergency Response Fund to support the response in Guinea and the Democratic Republic of Congo. With a consignment of more than 11,000 doses of Ebola vaccine arriving in Guinea, with additional 8,500 doses expected to be shipped in from the United States, Nigeria, just like other nations in the sub-region, need to get ready to combat any sudden outbreak of the disease. Mary Kanu, TV 360, Lagos.